You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories. And welcome to episode 436 of the podcast. And in this one, I chat with Dr. Stephen Phillipson and 3 members from one of his therapy groups, and those members are Sadie, Rachel, and Mike. Stephen is a licensed clinical psychologist who specialises in CBT for OCD. Stephen is clinical director at the Center for Cognitive Behavioral Psychotherapy in New York. And in this one, we discuss Steve's therapy group for OCD. We hear from his group members, their experiences in group, processing shame in the group, exposure and response prevention therapy within that group, the safety of sharing in the group, their favourite group moments, words of hope, and much, much more. And thank you to NoCD for supporting the podcast. NoCD offers effective and convenient therapy available in the US and outside the US. To find out more about NoCD, their therapy plans, if they currently take your insurance, or to download their free app, head to go.treatmyocd.com/the OCD stories, or the link will be in the episode description. Thank you to all of our patrons for supporting our work. To sign up to our Patreon and to check out the other benefits you'll receive as a patron, please see the link in the show notes. So thank you to Stephen for his time. Thank you also to Sadie, Rachel, and Mike. I appreciate them coming on and sharing their experiences. And as always, thank you to you guys for listening. It means a lot. Without further ado, here they are. Welcome to the podcast, Steve, Sadie, Rachel, and Mike. So it's good to have you all here. And, before I ask questions to your group members, Steve, it'd be good to find out more about this group, what it consists of, and just groups maybe historically at the center.
Sure thing. So winding the clock back to about 1990, I was working with a patient who had OCD, and she asked me whether there were any groups for OCD sufferers. And at that time, I worked for another center, and we had not been running a group. And I only knew of one group on Long Island that met once a month, just as sort of a touching base. And so she was, kind of very interested. So I asked one of my mentors whether or not we would be able to combine our patient loads and find out whether any of our patients would want to join a group. And we actually started out with about 12 members, and he led the group. I was a co-therapist. I had just begun sort of my career in working with OCD. And from that began the first New York City behavior therapy / support group in the city. And we modeled it a bit more on meeting on a weekly basis and offering both support and therapeutic guidance within the group. And generally, the group involved a adjunct to individual therapy. We felt that being a part of a 12-member group that lasted an hour and a half would not provide sufficient therapeutic guidance to warrant substitute for individual therapy. So we started the first group, and since 1990, that first group has expanded into the center now runs about 4 to 5 groups for OCD sufferers, and we meet at various times and generally offer a group as a adjunct to people who are in individual therapy or people who have been successful in behavior therapy and are in a maintenance phase.
Okay, good. And so is this current group, is this more of a therapy group or support group, or is it kind of like a hybrid?
I would say I conceive of it as definitely both, but Rachel and Sadie can definitely chime in and give your perspective.
Yeah, I would understand it as both as well. Much of the conversation, it's, group members giving each other feedback, encouragement, relating to a particular experience. And, Steve will, and his trainees also will intervene as well to give maybe more structured or fine-pointed guidance about how to deal with a particular challenge. So it's quite helpful to both get the support, the peership, but also like that more sort of penetrating therapeutic guidance as well.
Yeah, I'd agree with that. I think you get a lot of like therapeutically minded advice. It's a lot about like kind of taking a skillful path through whatever you're going through. And sometimes you just get people who relate and are like, yeah, I'm experiencing that too. I'd love to hear what people have to say about it type thing.
Mike has done, as has Sadie and Rachel, really tremendous work. Mike, I would say, if I can speak for you, that you're in a kind of wonderful kind of a recovery period, and your presence in the group has been an amazing gift that you're giving, a lot of guidance and a lot of support to the members, and also acting as an amazing role model of what really aggressive therapy can involve. So maybe you could comment on those factors.
Yeah, so of course, so in terms of the group and how I view it, I definitely view it as a therapeutic. It's an opportunity for me to open up and express myself and what I'm dealing with people and people who are going through similar circumstances. And it normalizes that experience for me. And I don't feel so alienated. And I think part of what OCD thrives on is the fact that we feel like we're so different. And it creates this fear within us. And it makes us afraid to even allow these thoughts that occur or these feelings that occur to be there. And as we get into these groups and we witness, oh no, this is just part of being human. This is a human phenomenon that we're having, that we have unfortunately associated with danger, and that has caused us to then have a physiological response that has that results in us reacting in ways that aren't helpful, and developing these patterns that cause us to be compulsive in our behavior, and being in the group and just being able to share that this is something I'm dealing with, and somebody else is like, oh, I'm dealing with that too, and normalizing it and making it a part of our experience. It really, really has opened the door for me and changed my entire perspective on these thoughts that I thought were unique to me and were saying something about me and who and what I am, and coming to recognize, oh no, they're just thoughts, and we all have thoughts, and that these things aren't representative of me whatsoever in any way, shape, form, or fashion. And I'm eternally grateful to the group and to everybody in all the group, and to Steve for creating it. I feel like without that support and without that normalization, I would not be in the space I am today, and I would probably still be deep in the obsession and compulsive behavior. And yeah, it's been a godsend, for lack of a better word. Grateful.
Yeah.
So one thing I would say is, one of the rationales for starting the group is, at least in 1990, OCD was an incredibly sort of known entity. There were a few shows like on Oprah Winfrey or Phil Donahue that portrayed people engaging in kind of bizarre behaviors, mostly hand washing. I remember a show where someone was walking back and forth as a ritual. And so there was a tremendous amount of ignorance, and B, tremendous amount of isolation tends to occur for people who have OCD in regard to keeping their themes a secret. And I think one of the tremendous benefits of the group is to really help the members deal with aspects of shame. Many of the group members have never spoken to someone else who has OCD, or at least spoken in a very knowledgeable and educated way. And I think that it really provides a tremendous community and camaraderie of providing, mutual support and understanding. Maybe you guys could kind of speak about that a little bit.
Yeah, I feel like there's an additional layer of shame of just knowing that your reaction is irrational. Like most people in my group know that their reaction to these thoughts is irrational. And I still feel all the time like really nervous to bring things to group, and it doesn't really matter what the theme is. It's like the fact that I know it's silly kind of like makes me really nervous to share whatever I'm thinking. So that level, I think like in addition to maybe identifying with your OCD thoughts and reflecting on like what that means about you, and kind of breaking down that shame, there's also then just breaking down the shame of like being so scared or guilty or whatever in the first place. That's been really helpful for me.
I just want to comment that Sadie is a contestant for the Most Creative Spike Award. She has second place trophy currently in terms of a very creative brain offering. I'm not going to mention for you what it was, but it really is. It's sort of a very fun contest that we have in the group to see whose brain can come up with sort of the darkest and most divergent type of creative thought. And, we really turn what for many people would be a horrendously judged thought into a little bit of comedy and, the ability to have people, kind of participate to win that trophy. And so I think it's a wonderful means to really normalize, our brain activity, no matter how dark our brains can sometimes wander.
Yeah, nice. Imagine the group does that for a lot of people, right? Is that, as you say, Steve, the irrelevance, showing the brain irrelevance, right? And sharing these spikes amongst others and seeing the reaction of the other members. And maybe they're like shrugging like it's not a big deal, but obviously in our head, it's this big scary thing. So yeah, I guess Rachel and Mike, anything else to say on shame and how the group may help with that?
Yeah, I found tremendous relief of shame during my time in the group. Particularly the like main theme that brought me to group was ROCD, and I was preparing for my wedding day. I was like 6 months out from my wedding when I joined the group, and the terror, right, with most themes and including ROCD is like, what if this isn't OCD? What if this is like my genuine sentiment and I'm about to make a terrible mistake that's going to harm many people? And coming into the group and seeing that many people have sort of a version of that worry, that their fears are true, that their thoughts are true, and that they're sort of living with that. They're allowing that concern to be irrelevant, or they're living with that degree of uncertainty of I'll never know for sure, and being able to sort of move forward and take action and take disciplined action in one's life without having the answer. That really empowered me to sort of get married, and took away some of that sense of like, I must be a terrible person to like make such a commitment in the presence of these doubts and fears.
Yeah, wow. Yeah.
And I'll just say regarding shame in the group. So what I like to do is I like to leverage the things that I feel like or I feel shame about around, and I use the group as an opportunity to share those things. Whatever the spike is that I'm having or whatever theme is coming up, I feel like this is a safe space for me to go in and say, hey, y'all, I was thinking about having sex with pink elephants, and just share that with the group and know that oh, I can be okay and I can be safe in this space. While I'm inside, I'm terrified to death. Like, and it feels real and it feels like something that I have a problem with. And it feels like, how do I get rid of this pink elephant thought? And I can go in here and I can release any type of shame that I have associated with any type of thought. And I feel that I'm not being judged and I can feel comfortable being able to go in the group and share these shameful thoughts with people offers me the opportunity to recognize that it's normal. And when I go out into the world, I no longer carry the shame in the same way because I found that there's a space for me to go and sort of to normalize these experiences. And I don't have to walk with that shame. I don't have to carry it in that same way. And I have allowed myself to make space for it internally. And I allowed it to be there and be a part of me and understand that it's okay that this is the thought or feeling that I'm having, not representative of me. And the group gives me that real world opportunity to practice that, carrying that and walk with it. Just to add on, I didn't say this before, but I might even go first in the group and say my most shameful thing that I'm dealing with, so that now I have the opportunity in the group to sit with that throughout the entire group and if in mindful of what's happening during the duration of that group, and not allow myself to sort of think about that shame and let it dwell and be a part of the problem.
Nice. Yeah, good way to look at it. And I guess just to clarify, the group, does it involve any exposure?
Sometimes we do exposure.
Okay.
It's I think it's a really very positive middle ground between someone keeping it to themselves or someone doing exposure out in society. And so you can do sort of this midway exposure amongst a very, very safe and trusting and insightful group of people. So, we definitely have used the group, even as Mike said, for Mike to, or even, Mike and Sadie and Rachel to even bring up and vent, put light on their spike topic. That in and of itself is an exposure because, many people live with the idea that, oh, if anyone knew what was going on in my head, I would be judged. And it's so within this very safe environment, you can, kind of vent and put light on these creative brain thoughts. And, it really, is part of the habituation process to be able to, share the content without kind of being judged, or even if you were judged, to kind of work on centeredness and autonomy where you wouldn't be a victim of that judgment. But I'm happy to say that the groups that we run are extremely safe environments where no one would ever react in a maladaptive way.
Good. And I can imagine it takes probably a little bit of time to build up those relationships or feeling of safety. So where you guys can share, or Mike, you can go in and share the really vulnerable thought. Is that fair to say that maybe took a few weeks or months to feel completely comfortable? Or there's lots of nodding.
Yeah, so I'll say when I started in the group that I was like reticent as with anything, but the position I've adopted is that generally anytime I start to feel that me pulling back, I need to push forward and lean into it. And the beautiful thing about the group is it makes space for that, and it's inclusive and it's absolutely wonderful. Yeah.
It's funny, some members do take a few weeks to kind of warm up and really observe the environment of their being in a very non-judgmental group, and other people, kind of right away. There was a woman who joined the group from Ireland many years ago, and after the group, she said, how do these people talk about such personal things in a group setting? Ireland is a country where people take privacy, I think, very seriously. And in the group, we sort of take privacy kind of the opposite in terms of, it's an environment where all topics are given a tremendous amount of, welcome and airtime, whether it be talking about OCD themes, talking about dating themes, emotional themes such as depression. So the groups really deal with quite a variety of life issues, although everyone in the group has OCD. So, by the way, Mike, your sex with the pink elephant, I'm not sure whether you gave that just as an example, because in the Friday group, that would be a contender for the trophy. What do you think, Sadie?
Yeah, I don't know. I feel like you've got a ways to go before you can get a trophy. I would say though, like the group, I was really reticent to join a group because I was like, is it going to be like an Alcoholics Anonymous meeting in like a film, and be really somber and awkward and like have this pressure to say things that are personal when I'm not ready? Like, it's nothing like that. It's so warm and often silly. And people can be going through really hard stuff, like most of us are or have been. But like, yeah, it's not at all intimidating, which I was really pleasantly surprised by.
So yeah, no, that's all really interesting. And I guess a question for all of you, including Steve, just your favorite moments or moment from any of the groups you've been a part of. Just if there's anything that really sticks out for you, that could be a really emotional moment, a funny moment, an inspiring moment, just anything along those lines.
Yeah. So, as I'm thinking, like, it's kind of hard to drill down to one specific moment. But as Steve mentioned, in these groups, we have times where it will go from a very intense, serious introspection where somebody's sharing about how difficult a spike is for them, how hard it is for them dealing with that process, to someone sharing about a spike, such as pink elephant sex, that will bring in energy and a warmth, as Sadie mentioned, that would just sort of transition from the heaviness to the lightness. And those moments where we feel completely connected and we feel like what we're coming to share matters, those moments, they're not a one-time moment. Those are moments that happen so often in these groups, and I'm so appreciative for that. So I guess that didn't directly answer your question. I know you were looking for one, but it happens so often, and it is what I truly value about the group.
Yeah.
Sure.
Nice.
It's funny for me. The moments that stand out the most are sort of the best and the worst. Is when a patient graduates. They've done very well and they become a real integral part of the group, and they're seen as a leader within the group, providing tremendous guidance, support, and also the modeling of what complying with the therapeutic guidelines can bring about in terms of life-changing recovery. And so when they sort of launch into their sort of independent life, and put therapy and group behind them, those to me are sort of the moments that sometimes stand out the most as being kind of bittersweet, because we all will miss that person, and yet we feel, so happy for the progress that they've made and their readiness to kind of, live life without OCD and without therapy. So that stands out for me.
And Sadie or Rachel?
I think what stands out for me in group is it really draws from like such a wide swath of humanity. We've got like successful authors, lawyers, stay-at-home moms, like young people just getting started. People who, like, if I pass them on the street, I may never think I have anything in common with them. And really through the shared suffering, there's just this, it's sort of this awakening of we are all suffering and struggling in our own ways, no matter how together or messed up we may look. We're actually probably not just OCD sufferers, but humanity in general. Struggle is a big part of it. And yeah, to bring it back to what Mike was sharing, like that we can find humor together, that we can bring like a lightness and a skillfulness and a discipline to that shared struggle. It sort of it makes you feel much less alone in the world.
Yeah, good. Yeah. And
Yeah.
Sadie, I know you got to go in a sec, so
Yeah, I just second what Mike and Rachel said so much. Like there are so many moments, and I just love keeping up with the lives of everyone in my group. It feels like a real pleasure and an honor. One funny moment in particular, we were struggling to hear some of the folks in the group because obviously some are remote online and some are in person. So a group member brought in like a pink fuzzy microphone to pass around. That was a good one.
nice. And yeah, I'm sure it's hard to pinpoint one single moment in I don't do groups. I do an annual OCD camping trip, and that is a group, obviously a 3-day group. But yeah, to pick out any key moments is hard because just each stage there's just something going on that's meaningful or important for individuals or the group as a collective. Are there any tricky aspects you guys have found or felt about the group?
What do you mean by tricky, Stu?
Yeah, I wanted to leave it open-ended to see how you guys interpreted that word. I think I just meant more maybe tough. So obviously starting the group is probably tough for a lot of people, right? Especially if they're introverted or social anxiety but and like Mike shared about sharing the sexy pink elephants, like if for some people that's really hard to, yeah. Just anything anyone wants to say.
I would say, even though I've been in group for over a year, I'm still a perfectionistic, anxious person with OCD, and that does inhibit my participation at times. I've actually, even though I've never been met with anything other than acceptance and connection around the content that I've brought, I still have those fears of like, this is going to be the time where someone says, that really doesn't sound like OCD to me. Like, maybe you actually shouldn't be in this group. And yeah, I mean, that's, I guess, a spike in and of itself. So it goes back to what you were asking, Stu, earlier about exposures. In a way, every time I speak in group, it does feel like a bit of an exposure. And I'm fortunate to have Mike in my group, and he's such a great example of what it is to take that up and embrace it and lean into the discomfort rather than letting that old habit of falling silent in a moment of discomfort run the show. So it's still a work in progress, even a year in.
Yeah, that's great. Good point.
And I'll just say, in terms of tricky, so like what I found early when I got into the groups is, and I didn't recognize it until somebody pointed it out, but I was like going to the groups with a very much, this is what I'm here for, this is what I need to do, and then I'm going to be gone. And as people were sharing their different spike things, I started taking on some of those spike things. Like my brain started to try to latch onto those things. And that began to drive a fear in me. And I had to learn how to navigate through those spaces to be able to hear someone share about a somatic experience that they were having and be able to have the fear of come to me that, oh, maybe I'll be stuck with the feeling of my breathing, or maybe I'll be stuck afraid that I'm going to vomit, or maybe I'll be stuck in XYZ, and learning to let those things come in and being able to process and sit with those things. That was a very difficult thing for me as I came in a group. And I recognize now in retrospect, I was really trying to push back and had fear around those type of things, and learning just that whole acceptance of that and being able to go through that process was extremely difficult at the time and tricky for sure, but it gave me so much value on the back end that I can, and I don't feel like I could have gotten that anywhere else, because maybe in real life I'd have just kept avoiding those type of, what I mean. And being in the group put me in a space where I could hear all these different type of things that I didn't even know I potentially had a fear of, and just learning how to navigate through those very tricky moments have been invaluable as well.
Yeah,
So
good.
I'll just
Yeah, go for it.
I'll just jump in and say
Mhm.
that it's a very common concern when people
Mhm.
are considering joining a group that they might sort of catch other people's spike themes. And I'm happy to say that that's actually a fairly rare event. People might become aware of other people's spike themes, like swallowing. Whenever my patients talk about the three big somatic OCD themes, swallowing, blinking, and breathing, of course, during the appointment, all I'm aware of is my swallowing, breathing, and blinking. And lately, I've actually picked up some tinnitus, and I have three patients who have tinnitus OCD. And of course, talking to them, all I can hear, and it's currently happening now, is this really loud humming in the background. It just gives me an opportunity to make room for that awareness. And, it even gives patients the opportunity to practice the principles of behavior therapy, which, are acceptance. So rather than being like, oh no, I don't want to be aware of my swallowing, in a recovery mindset, you'd say, okay, brain, make me aware of my swallowing.
Mhm.
So that's definitely one of the tricky concerns, which often does not bear fruit, the idea that you'll catch someone else's spike theme. And what's a sort of a funny phenomena in the group, which is very, very common, is that everyone says, oh, I wish I had your spike theme. Because one's own spike theme, is lit up with this authentic energy of a catastrophe. And so when you hear about someone else, and one of my favorite examples is someone who had a thought. He was putting an apple seed in his garbage disposal, and he got the thought that apple seeds contain what is it? Which
Arsenic.
arsenic. Apple seeds.
Our,
Apple seeds contain arsenic. And so he had the thought that he was going to poison his entire building by putting his apple seed in the garbage disposal. And I can guarantee you that everyone in the group that day, we had the greatest laugh about, an incredibly imaginative Spike, but also to say, oh, I wish I had that. I wish I had that turn. Because that would be really easy to kind of embrace. But that's sort of a very common phenomenon because it really, unfortunately, fails to recall that, every spike theme is actually entirely equal. There is no such thing as one spike theme being sort of worse than another. Although I would say that pedophile spikers, tend to express the greatest degree of shame or concern for judgment.
Yeah, true. Um, yeah, it's a good point on all of that. And Rachel, you mentioned just now that you've been in the group for about a year, and earlier on you mentioned you started the group 6 months before your wedding. So I'm just curious how that's gone, if you want to share.
Yeah, thank you for asking. It's actually going really well. I still have days, of course, where I spike on, is this the right relationship? What a loser, all this stuff. And the spike has morphed actually into like, should I have a child? Am I in the right profession? Like it shapeshifts.
Yeah.
And that sort of initiation of going through the getting married process was with the support of the group and my therapist. Like it was so intense and really forced me to learn quickly how to cope more skillfully. And I, at the risk of providing reassurance to others who may have this theme, I'm really glad that I did not listen to my fears and went through and got married to an excellent person. I was thinking of my favorite moment in the group, and one moment, one sort of running joke in the group is that there's an OCD God, that like something will happen in your life that is so spiky and so unlikely that it seems to really confirm that like the universe is trying to tell you your fears are true. And I lost my engagement ring just a few days before the wedding. And I was like, surely this is a sign from some deity that this is not supposed to be. And having the group to run that by and joke about it, that I was, headed for disaster and making a terrible mistake, allowed me to live with the discomfort and not act out, but rather keep moving toward my values, which was deepening my relationship with this person.
Yeah, that's really good. A good example of how the group helped. And maybe it was a sign that the engagement's ending and now time to get married.
Yes, exactly. Exactly. Like the time for waffling over, obsessing over this decision is over. It's time to act and take a chance, take a risk.
Yeah. Did you ever find the ring out of curiosity?
No, someone is walking around with a very nice engagement ring. I don't know what happened.
Yeah,
Hey, Rachel, I'm rooting for the cubic zirconian for about $200. You can get a nice 2-carat ring, and no one will be able to tell the difference. And Stu, you were very naughty to say the sign is the end of engagement, ready for marriage, because we were friends in the group, and we try to discourage reassurance. Although some people are more tempted than others, and it's very, very common that group members will offer reassurance. And I think that sort of leads me to one of the points I wanted to make in terms of a professionally led group, rather than, like, there is such thing, I'm not sure if it still exists, like OCA, Obsessive Compulsives Anonymous, which are not professionally led groups, or other groups that are not kind of professionally led. I've heard some very dissatisfactory stories about them, in terms of sort of the blind leading the blind. And so I would say that if a person were thinking of joining a group, I'd strongly recommend a group that has a kind of experienced professional running it, rather than it just being people getting together. Because I think it's like when you go on a forum for OCD, it's just people looking rampantly for reassurance and often getting it, and obviously that doesn't really bring the recovery ball forward.
And
Good point.
yeah, I'll just add to that. Before I joined this group, I tried an OCA group and a just shared group with no professional lead in it, and it seemed to not have the as much direction and as much guidance as has been found in Steve's groups that he has. And it's been night and day. And I left those groups and came to this one, and I've been here for maybe 8 months now or something like that. And it makes a world of difference. It does, especially having somebody with experience and understanding to sort of guide you and lead you when you don't know as well. And I will say, Stuart, I appreciate you as well. Just going to throw a little gratitude your way. I found Steve through your OCD stories as I was like really coming to understand my OCD situation. And what you do is a incredible thing for the community. And I don't know if anybody's given you your flowers and tells you have greatly impacted and helped change my life. Without you, I don't find Steve potentially, and I'm not at where I am today. So your work is amazing. Like I said, I don't know if you know that, but it's really, really, really been valuable.
Thank you. Yeah, I appreciate it. That means a lot. Yeah, thank you so much. And I'm glad you're able to find Steve and the group, and then that's helped. So yeah, thank you. It gives me motivation to keep going. So I guess I don't know if it's words of hope, words of advice, words of hope, words of action, encouragement to anyone listening that maybe wants to start, whether it's a support group for OCD, whether it's a therapy group for OCD, just anything you would kind of say to them to maybe encourage them, or yeah. And that's to all of you, that question.
Yeah.
Go ahead, Rachel. Go ahead, Rachel.
I would say, echoing this point about having professional therapeutic facilitation, I really agree. Trying to join something that's led by someone with expertise is really valuable. And I would say, I think shame is often what holds us back, right, from seeking connection, community, help around these issues, and the terror that, someone's going to tell us our fears are real, and it's not. At least that was it for me, like the fear of, I'm going to join this group and everyone's going to sniff me out as the non-OCD person in the group. And I would encourage people to take the risk, live with the possibility that someone might say something that's really going to scare you or spook you, or something really challenging might come up. And it's that very experience of taking the risk of experiencing fear, discomfort, that is ultimately transformative. And we've heard some wild themes, some wild thoughts in the group. It's really kind of given me the sense of so much we judge ourselves as so abnormal and so wrong and bad, and that sort of our naughtiest thoughts are really just a facet of our shared humanity. And we all have them, and life gets a lot easier when we can sort of look at each other and acknowledge, like, yeah, this is just a part of who we are.
Yeah, nice.
I would say it's just a part of how the human brain tends to work, in its infinite creativity, and it's not in any way a reflection of the person's character, even if they have completely bizarre thoughts like having sex with a pink elephant. And Mike, I'm happy to say that has never come across my radar. So I'm imagining you made that one up. And I'm just thinking about the step ladder that you'd have to use to achieve that goal. Was that pink also? So one thing I would just also share, because of a unpleasant experience that happened about 25 years ago. I used to just let everyone join the group who said they had OCD. And one Friday night, a new group member came to disclosing what his OCD themes were. And he started talking about masturbating 15 times a day, and he engaged in a lot of dangerous sexual activity. And it occurred to me within about 2 minutes of him opening up that he did not have OCD. He had a sexual addiction, which was not based on anxiety, but more pleasure seeking, which sex can be. And so, I sort of interrupted him and took him outside of the group and explained that he had sort of found his way into an inappropriate group. And so from that moment forward, all new members of the group are screened before they can join, unless they're all also patients at the center, so we can really kind of verify that they do have OCD, because that can be a mistaken, and B, that they're interpersonally, kind of skilled enough to function effectively in a very vulnerable group environment. That's why I said before that it's a very, very safe environment, and no one would ever be responded to in a way that would be inappropriate.
Yeah, good point. Yeah. Yeah, and I'm sure most therapy groups do those assessments, right? I imagine support groups typically don't, because it's just turn up and get support. So yeah, and Mike, I don't think we've heard from you on what you'd tell.
Sorry, Stu, can you just run the question back again?
Yeah, it was just I can't remember. I don't think you answered it, but it was just what you would tell people thinking about joining a therapy group. What sort of words of advice or encouragement you'd give them?
Yeah, I would say if you're thinking and considering joining a therapy group, you should definitely go into it. And if you open up yourself and allow yourself to become comfortable, the therapeutic results can be transformative. You can see that who you are is okay, and you can see that you're accepted just as you are, and that's okay. And you don't have to walk in fear and live in shame of who and what you are. And you can accept all these facets of your personhood within the group setting, and that can act as a stepping stone or a place to leverage you accepting it within yourself.
Yeah. Nice. And I guess to everyone, just anything else any of you want to say about groups or this group, or anything that we haven't covered?
Yeah, I'll just say this about um, OCD and my perspective on it, and how group has helped me shift that perspective. For me, uh, the primary driver of my OCD has been fear, and fear is best sort of its strongest weapon that fear has. It's like the ability to isolate you and keep you alone and make you feel like uh, this thing that is residing with you is something that can't be quelched, and the only thing that you can do to quelch it is to serve it whatever it wants, and that as you know, it's compulsions while active OCD cycle. But stepping outside of that fear, it's like the light of a new day shining on you. And when you can go and move into that space, it's beautiful. And there's also people in groups who have been dealing with this disorder for a longer periods of time, and they can share something that might seem that you don't even recognize how pivotal that little perspective shift is, and they can give you that, and it might take you 5 years to learn that on your own or going through the process, but in group somebody can share it with you in an instant, and you can apply it to your life. And yeah, that's something that I haven't found anywhere else. And I've read books and I've watched videos and I've heard, read different blogs, and actually going and having that live interaction and that feedback, and people to say, I felt what you felt, and I've been through what you've been through, and I tried what you tried. Maybe try this, Mike. Maybe try this. And I'm like, and then I go and I try and I apply it. I'm like, oh shit, that shit worked. Thank you so much. And it's like, that might have took me 10 years to figure out on my fucking own. And, going to group and learning and recognizing I don't know what I don't know. But it's somebody in there's somebody in here who likely does know.
Yeah.
And Steve will definitely, he's like, I look at Steve like I look at like Phil Jackson or something, like, like a great coach for a team. And like, I don't know what the hell I'm doing. This is my first time living life. But Steve has coached people through the situation I'm going through. Let me lean on him. And then when I go to the group, okay, now I got these other players on my team, and they can show me how to dribble better, or shoot better, or do this better. And it's like nothing I can't even quantify how valuable that is. And in order to get better at doing a thing, it's good to leverage those that have done the thing and have knowledge about it. So that's what group is for me. And now I'm just in a space where I hope that when I go to group and I share as openly as I can about all my experiences, it empowers others in the group to do the same. And it shows them that it's okay. Or like I'm trying to show it's okay. I don't have to be ashamed of having a homosexual thought. I don't have to be ashamed of this thought I had of stabbing my son. I don't have to be ashamed of these things, of being a pedophile. I don't have to be ashamed of my fear that I might hurt somebody or I might do this thing. And whenever I do speak, I always try to say whatever it is exactly to the point that I can, because that to me sort of pulls back that curtain. Things that OCD is saying, hey, tuck that away. I'm like, no, I'm going to open up. I'm going to show, and I feel safe in this place, and I feel like they'll understand, and that's what group offers you. It offers you a place where you're understood. Yeah. I think that's something we all seek. So eternally grateful for that.
One of the sayings that I mention when I mention group to a particular patient is the idea of as we teach, we learn. And I think that as patients can provide each other with guidance, with things that have been beneficial for them, strategies that they've used, that they've seen really good effects with, that it really bolsters their own sense of commitment to employing exactly those strategies and sort of keeping the faith of the behavioral skills. I think also group provides a certain degree of accountability. People make commitments to doing exposure work, and to have a bunch of 12 peers really rooting for you and counting on you and often checking in on you the following week with, hey, you said you're going to do X, and we're really looking forward to hear about how that went. That accountability can really be very instrumental in remaining very committed and knowing that you're not alone in doing and practicing the behavioral principles.
Yeah. Nice. And Rachel, any final thoughts?
I'd just love to give appreciation to you, Stu. Like Mike, your podcast brought me to the center, and to Steve, and my appreciation for Steve. His work is amazing. It has really transformed my life, and I would encourage anyone to check out his writings, his choice essay. What's the website, Steve?
OCD online.
Yeah, I would encourage people to check those out and to, check out the center. We've got people from all around the world in the groups. It's really helpful.
Yeah, brilliant. Thank you.
Our Tuesday group has 3 women from Australia, and it's our Tuesday night. It's their Wednesday morning. It's a pretty funny time phenomena.
Yeah, it's quite a difference between where you are in Australia, right? Yeah. Geez. So thank you so much to all of you, and obviously to Sadie, who's already had to leave a bit early. Been a good conversation, and hopefully, I'm sure it will help people considering group therapy as an option or an addition to one-to-one therapy.
And thank you again, Stu, for providing this platform to educate the world about really important aspects of OCD.
Thank you for listening to this week's podcast, and thank you to our Patreons who helped make this episode possible. And if you would like to find out more about Patreon and the rewards and benefits, then there will be a link in the episode description. If you enjoy the OCD Stories podcast and would like to support us, please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. And if you want to find out more about NoCD, head to go.treatmyocd.com/the OCD stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.